From the General Motors building in New York City.
This morning on Health Watch, piercing, certainly not just for ears anymore, with celebrities like Paris Hilton and Christina Aguilera leading the way. It's becoming more and more common for people to pierce everything from their bellies to their tongues. Well, our Dr. Emily Sine is here with some advice on how to stay safe. Good morning.
Good morning. Well, the body piercing industry in this country is largely unregulated, so it's important to know what to look for in a piercer, or you could expose yourself to serious infection.
Everything should be single-use and sterilized. The needle should be in a completely sterilized package that should be opened in front of you. They shouldn't be pulling anything out of jars full of whatever that hasn't been sterilized. You never know what's on it.
Professional body piercer Suzanne Beam wants her industry to be safer.
In a lot of places like New York, there is no legislation governing tattooing or piercing, so anyone who wants to can order equipment from a magazine and start piercing people.
She's proposed legislation in New York that would create licensing and inspection guidelines for all body piercers. Her efforts could prevent a repeat of what happened in Rochester, New York.
We had 15 documented cases and an additional 30 suspect cases of infection related to cartilage piercing.
Valerie Batsford was one of those cases.
I couldn't make it through work. I couldn't even stay awake or stay coherent pretty much.
A bacterial contamination at a local piercing shop landed her in the hospital for 6 days and home from work for about a month. Because her piercing was through cartilage, her case was particularly severe.
Cartilage tends to have poor vasculature, so if you get an infection in the cartilage, it doesn't clear up as easily as it would in some other part of your body that has a better blood flow.
Better blood flow like the tongue, where Michelle Levy chose to get a piercing.
I thought it was the cool thing to do at the time.
Now she's having problems.
When I bite on the back of the bar, on the ball, I have this intense pain on my teeth.
And her dentist, Dr. Marc Liechtung, is concerned about the long-term effects of a piercing in the mouth.
People have a tendency to either play with it or accidentally bite on it over a long period of time. This can cause broken teeth or an irreversible problem with the nerve of the tooth, causing a patient to need root canal.
Since the mouth is full of bacteria, a tongue piercing can lead to even more issues.
It can cause a buildup of plaque and tartar, which then could get into the bloodstream.
Beam says check the safety and hygiene of the piercing studio you're interested in and ask around.
People that have had good experiences with a piercer will tell everybody about it.
And for Valerie, no more cartilage piercings.
Whether it would happen or not, I don't ever want to face myself with that again.